This is 30 days old neonate. You can see this is apical 4-chamber view. All chambers are dilated. Global hypokinesia of left ventricle, right ventricle. Only 30 days old. So we always we take this case as a cardiomyopathy or myocarditis. That is common scenario with this presentation. But this case has got different thing. That is why I have made this video. You see the aortic valve is not opening fully. It's very opening very less. This is, you see it in this image, aorta and pulmonary artery normally related, that is perpendicular to each other. Now you see the doming of aortic valve. This case has got doming of aortic valve. Valve is simply doming. See, this valve is doming, and post stenotic dilatation is also there. Not that much significant, but there is dilatation. You can see this valve is bicuspid. You see this bicuspid aortic valve. But you see in this image the opening is quite good. But this case has got severe aortic stenosis, because in the plane in which you are taking the image is not exactly the part where the valve is most stenotic. So image wise you see the valve is opening properly, but this case has got severe aortic stenosis because we are not taking the point at which the valve is most stenotic part. So sometimes you miss just by seeing this image. That can be seen in parasternal long axis view. You can see this is a moderate MR, moderate TR, and you can see the turbulent flow across aorta. This is turbulent flow across aorta. You see this is turbulent flow across aorta, aortic valve. You see the most turbulent flow. You see the turbulent flow. This is very turbulent flow here. You can see this is the aorta. You see, whole portion of aorta is not getting the flow. Only the very, you see that this portion is only getting the blood. This portion is the most stenotic part. Now see, this is the aorta is the most turbulent flow is here. This is arch and descending aorta is normal, no coarctation of aorta. Again you see the same thing, no coarctation of aorta, no coarctation of aorta. You see the ascending aorta is very turbulent flow. You see this here. This is the left ventricle, this is aorta, and here flow is quite turbulent. This is suprasternal view. You are seeing the flow left ventricle, then ascending aorta, then arch. So this ascending aorta flow is quite turbulent. Color pattern indicates increased velocity. As their global hypokinesia, left ventricle is failing, so gradient wise you cannot find severe aortic stenosis. So you have to apply continuity formula, continuity equation, to find out the exact area of aortic valve area and severity of aortic stenosis. Same thing, ascending aorta. You see this is IVC is also dilated, size wise almost same as that of aorta, even slightly more, and size variation along with respiration is also diminished. In this case I want to show you the continuity equation. So you see this is the velocity LVOT VTI. So how will apical 5 chamber view? You have to put the pulse wave cursor in LVOT part. Then you will get the velocity of LVOT velocity. By formula, it will give you LVOT VTI, velocity time integral. You can see that the velocity time integral is, this is 4.24 centimeter. You have put the cursor in LVOT area. This is pulse wave velocity. You are here just measure the time velocity integral. This is the velocity. If you just measure like this, then this will give you time velocity integral. That is velocity multiplied by time. That will give you distance. This is velocity time integral. That is 4.24 centimeter. In next image, this is the velocity across aortic valve. You can see this is the, just you have taken velocity time integral again. You have drawing like this. When you draw like this, then that will give you velocity time integral. The next thing is just you have to measure the size diameter of LVOT. So this is parastern long axis. This is the measurement. What is this? Is measurement of LVOT diameter, that is 0.8 centimeter square. Ultimately area, aortic valve area by velocity time integral method is 0.05 centimeter square, and aortic valve area by Vmax method it is 0.04 centimeter square. Baby, this in neonate, 30 days old neonate is having this much less aortic area, indicating severe aortic stenosis. So aortic valvotomy is urgently required in this case. So you have to know how to apply continuity equation. So for that, again I want to repeat it. You have taken the velocity in LVOT region, left ventricle outlet region, just inferior to aortic valve. This is apical 5 chamber view. So just inferior to aortic valve. You have to take care of the pulse wave here. This is the part where the LVOT velocity. Then this comes here, just measure like this. That will give you LVOT VTI. First thing. Second thing, just measure across aortic valve, velocity across aortic valve. Again the calculate velocity time integral. This will come like this. Again just calculate LVOT diameter. You have to do three things. Anyone can be first or second, it does not depend, but you have to calculate all these three things: LVOT velocity, aortic valve velocity, and LVOT diameter. After that, when all threes are taken, then machine will give you the exact area: aortic valve area by VTI method, aortic valve area by velocity Vmax method. That is coming very less, 0.05 centimeter square, 0.04 centimeter square. In case of adult, area less than 1 centimeter, severe aortic stenosis. But in case of, this is 1 month old neonate, so definitely it has to be very severe one, severe aortic stenosis. Ultimately all left ventricle, right ventricle, everyone is failing. Again you see that the apical 4 chamber view indicating severe LV systolic dysfunction, severe RV systolic dysfunction, moderate MR, moderate TR, mild to moderate PAH. Ultimately this case has to be operated for aortic valve stenosis to save this child. Thank you.